Let's discuss the advancements in the treatment of cancer. Dr. Raja, let me start with the diagnosis part of it. How accurate are liquid biopsies for hard-to-reach tumors?
Oh, they are increasingly becoming popular and they are becoming increasingly efficient, I would say. We are using it in two settings. One is in the primary diagnosis setting where there is a newly diagnosed patient or where there is a strong suspicion of patient wherein a tissue pathology is not yet established in a difficult to reach site. And that's a very challenging subset of patients, but those patients are now or also there, and wherein I would say that 70 to 80% chance that you will be able to demonstrate the possibility of a malignancy in them. But liquid biopsies are being increasingly used in the secondary diagnosis setting where there is already a diagnosis of cancer, and then you want to longitudinally monitor them for the changes
Yeah.
in the DNA profile or for the follow-up or for early detection of the recurrence or in response assessment. In both the contexts, liquid biopsies are becoming more and more useful, and they are becoming as good as what we call as solid biopsies. Sometimes they are more versatile and more useful than solid biopsies.
Okay. All right. And what about traditional therapies such as chemotherapy, radiation? Have all of these advanced? Have side effects reduced, Dr. Raja? Is it less invasive? And is it applicable to all cancers as well?
Absolutely. Over the past 2 decades, apart from the various improvements that we saw in the cancer care, the best thing that has happened is to improve the quality of life. As regards to chemotherapy, now the drugs have become more and more sophisticated, and we increasingly use what we call as antibodies and conjugated drugs and so on and so forth. And we now have targeted drugs which specifically act on the cancers. And the side effect mitigation, supportive care drugs have improved tremendously. Now we have good drugs to mitigate vomiting and mucositis, diarrhea management, and neutropenia management have all improved tremendously. With regard to radiation, now the technology has improved to be more and more precise. From the days of cobalt and 3D, three-dimensional radiation techniques, now it has advanced to what we call intensity modulated radiation, image-guided radiotherapy techniques, cyberknife tools, and we now have the most advanced proton therapy. The concept is that the radiation is becoming more and more precise, exactly contouring the tumor so that you can avoid the normal tissue and thereby improve the efficacy, dose delivery, and reduce the side effects. Similarly, with regard to surgery, also, the minimal access surgeries have become more and more available across the country. The experience and the prolific use has increased tremendously in all centers, including laparoscopics and robotic surgeries have made it possible to operate even in vulnerable individuals, elderly individuals. So these are all
Sure.
tremendous changes that have happened over the past couple of decades.
Okay. Dr. Haribhakti, when it comes to surgical advances in cancer, I want to talk specifically about breast cancer with you. And what are the advancements there? For example, if in case somebody is diagnosed with an invasive cancer, is there any chance of saving the breast in terms of surgery? And what are the advances when it also comes to, say, reconstructive surgery?
Sure. So let me start by telling you that a diagnosis of cancer of the breast, almost more than 80 to 85% of the time does not mean removal of the breast. Today, and this has been established for the last 30 years all over the world. In fact, a prospective trial from Italy clearly established the safety of breast conservation surgery. So today, a very large proportion of the work we do is breast conservation. Now, in breast conservation also, there is a further refinement over the last 10 years or more called oncoplastic surgery, in which the incisions and the approach is planned in such a way that the breast is practically restored to a normal looking breast. Today, in our follow-ups, very often students find it difficult to tell which is the treated side because the results are so perfect. So I wanted to start with that. Okay, mastectomy, which is removal of the breast, is required in a minority of patients. Furthermore, if mastectomy is necessary, and there are clear-cut criteria for those who need mastectomy, there is very much possibility of reconstruction, and reconstruction broadly is either implant-based or patient's own tissue-based. It's called autologous tissue-based. So both are very reliable, extremely good, with very good outcomes. So today, if you ask me, in practice, for a young individual, when I say young, I mean up to the age of even 50 and 60, and the oldest lady on whom I did a reconstruction was 75. She wanted her form to be preserved. We are able to offer immediate reconstruction.